Let's take a look at the latest figures concerning the coronavirus, and we can see that just over 1,900 new infections were recorded in the past 24 hours, as well as 4 deaths. Now, in terms of vaccinations, well, the number of people who've had a first jab has risen above 36.5 million, or nearly 70% of the UK's adult population. Just over 20 million people have now had both doses, and that's getting close to 40% of all adults. Well, let's discuss this further. I'm going to speak to Dr. Bharat Pankania, who is a senior clinical lecturer at the University of Exeter Medical School. Thank you for joining us here on BBC News, a familiar face, of course. So first off, let's just talk about the Indian variant and vaccines. The government says that they have confidence that they are effective. What are your thoughts on that?
We have laboratory data that indicates that the vaccine is not bypassed by the Indian variant. The absolute proof will be testing it out in the field, in other words, to see how well it performs out there in the community, meaning if people are fully immunized and they get infected by the Indian variant, we will know. And if they are protected by the Indian variant, we will also know. So we've got some way to go to find out absolutely if the vaccines are not bypassed by the variants.
When we look at the case studies, for example, of Blackburn, the third highest infection rate in England, 89% jump in cases they've had compared to the previous week. What's actually behind that surge? Is it the resident Kent variant, or is it the fact now that the India variant is within the population? What's behind that jump?
I would almost say it is a combination of several factors. One, the location and the people who live there. In other words, families, multi-generational household, people working in crowded, busy places, factories, buses, shops, those sort of things, as well as, this is important, we feel that the variant Mark II emerging from India is potentially more infectious. So we have a perfect combination, unfortunately, of people living in crowded homes, shops, businesses, all those things, as well as a more infectious variant on our hands.
More infectious, does that also imply that it will produce a more extreme case of COVID-19?
I hope not, and this is what I am really hoping and wishing for, which is, whilst on the one hand it may be more infectious, I hope it doesn't translate into more hospital admissions, meaning more disease causing. Having said that, even if it is as normal a disease causing as the previous variants were, we can expect cases to arise, and my concerns are in the younger age group who are yet to be immunized.
So we've picked up that the India variant is in most parts of the UK now, more prevalent, of course, in some counties. For those people who are presenting with the India variant of COVID-19, are you able to give us a profile of who they are? Have they had a vaccine? How old are they, for example?
So most of the people that I am aware of are in different parts of the country, Lancashire, east of England, and places which have a link with India, Pakistan, Bangladesh. And then, of course, it will spread amongst the local population too. With regard to who is affected, now that we've got an older population who is immunized, we are seeing cases in the younger age groups. So across the board, in the younger age groups, small numbers, except in Lancashire, east of England, where we've got more cases and more cases of that variant rising dramatically.
Do you think the India variant is now most definitely the dominant strain within the UK?
It's getting there. What I want to emphasize is these variants will come and go. We had the Kent version, Brazilian, South African, and now the Indian variant. They'll come and go. What we want to do, and I was really pleased to see in your report that in Lancashire, they're going to provide extra immunization as fast as possible. That is the strategy to adopt, which is wherever the hotspots arise, send in a hit squad and do extra immunizations as fast as possible. That will keep the infections down, suppress the numbers.
Do you think then that we should have, the government should have implemented the surge vaccinations earlier?
That is my opinion. Absolutely. I think the surge immunization is one good tool that we've now got in our hands, and we should use it, especially as we don't know a few more things about this virus, the variant, and therefore better to keep its numbers down. One way to keep the numbers down, immunize extensively.
OK, we're hearing now that there are some areas within the United Kingdom where they are finding themselves with a surplus of vaccines, and they're offering them to pretty much anybody of a much lower age. Does that make sense to you?
Well, if there is spare vaccine supply, then they should immunize whoever that needs to be immunized. The more people that are immunized, the better we are, in a better position, because eventually what happens is an immune population secretes fewer of these virus particles, and then the case numbers will go down and stay down, and we will have a protected population. So if there are any spare vaccines, complete your vaccination course, and if you haven't been immunized yet, please get immunized. It's a good thing to do. It will protect you.
We are seeing now that as the rates of some cases related to the India variant are being described as exponential, and that's the concerning term, isn't it, when we're talking about communicable diseases. How concerned are you about that? And at what point do you think we are going to see a third lockdown?
I hope we won't see a third lockdown. And one way to avoid a third lockdown is to do those control measures. So what you do is send in extra supplies, extra manpower to do extensive testing. And whoever you find is a case, remove them from circulation, remove their contacts from circulation, immunize the contacts, immunize all the other people, and keep a grip on that place and restrict movements in those places. And if you do all of those things, as well as the United Kingdom is heavily immunized, hopefully we will escape a third lockdown.
You know, we're hearing a lot about the public being weary of all this and obviously looking forward to an easing of restrictions tomorrow. From your expertise, is the evolution of the coronavirus normal, or are you surprised at the way it's evolved and mutated?
This is such a lovely question, because we didn't expect the coronavirus per se to mutate so frequently. And the fact that it is mutating so frequently is telling us something, which is we've got a lot of it replicating around the world. So when you've got such a lot of reproduction in so many people, evidently you will get the emergence of variants. And the variants that are arising is telling us that the infection in other parts of the country, in other parts of the world, is not in control, and hence the emergence of variants.
Dr. Pankania, thank you so much. It's been fascinating. Thank you very much.
Thank you.